We are pleased to welcome you to the virtual launch event of the quadripartite One Health legislative assessment tool for antimicrobial resistance. I've had the pleasure of coordinating the quadripartite team responsible for the development of the tool, which includes my colleagues present in this session. From UNED, we have Aitziber Echeverria, Program Management Officer and UNED Liaison Officer to the AMR Quadripartite Joint Secretariat. From WHO, Jorge Mateo, Team Lead at the Impact Initiatives and Research Coordination Unit of the WHO AMR Division. From WOHA, David Sherman, Program Coordinator in the Capacity Building Department of WOHA, and Kelsey Garantich, an international legal consultant in the same department. And my colleague from FAO, Valeria Pasarin, international legal consultant at the Development Law Service. But also other colleagues who have worked really hard to get this done, but unfortunately are not here with us today, including Camille Lois, Martin van der Heyden, Ambra Govena, and Teemu Viinikainen. This project has received the financial support of the Multi-Party Trust Fund and is based on previous work funded by the UK Fleming Fund. This session will be moderated by my WOHA colleague, David. David, the floor is yours.
Thank you, Carmen. Welcome, everyone, to the Quadripartite One Health Legislative Assessment Tool for Antimicrobial Resistance launch event. Before we begin, let me tell you that more than 500 people have registered for this launch event, and we are truly grateful for the huge interest received from people from around the world and representing all relevant sectors for AMR. We'd like to remind you that for this morning's session, we have simultaneous interpretation from English to French. And at the afternoon session, we will have simultaneous interpretation English and Spanish for those participants who require it. You can select the interpretation option in the interpretation icon at the bottom of the screen. Also, for the optimal development of the event, let's all convene some housekeeping rules before we start. Please rename yourself with your name and organization and country. To do so, just right-click on your own box, click on rename, and then type in the requested information. Be reminded that the views presented are those of the speakers. We kindly ask you to refrain from advertising your services, your company, or any product or brand. If you have questions, post them in the question and answer box by clicking on the Q&A link at the bottom of the screen at any time. We will try to answer your questions as we receive them, but we'll also save some questions for oral discussion during the Q&A session later in the hour. Finally, we remind you that this meeting is being recorded, and the video recording and the PowerPoint will be posted on the Quadripartite AMR website and the websites of the four organizations. And now, without further ado, let's begin. And it is our pleasure to introduce you to Dr. Tanawat Tensen, who will share with us some welcoming remarks. Tanawat is the Director of the Animal Production and Health Division at FAO and the Chief Veterinary Officer. Tanawat, welcome. The floor is yours.
Thank you. Thank you very much, David, for your introductions and also moderations. Good morning, good afternoon, and good evening, depending wherever you are. And I would like to take this opportunity to welcome all of you to the virtual launch of the One Health Quadripartite Legislative Assessment Tool for Antimicrobial Resistant AMR. When you're talking about legislations, especially the issues like antimicrobial resistance is very complex, because when you're talking about antimicrobial itself, it linked to many, at the country level, it linked to many ministry. When you're talking about the import, it will link to the Department of Import of Antimicrobials. It will link to Ministry of Public Health, Ministry of Finance, Department of Customs. When it goes to the use of antimicrobial in different sectors, it will link to at least Ministry of Public Health, Ministry of Agriculture, Ministry of Food, and so on. And that's why the tool that our colleagues from Quadripartite AMR Collaboration, FAO, UNEP, WHO, and VOA is very crucial. And that's why these tools it's the right time that we present you the tool and which has been developed in the framework of a quadripartite project funded by AMR Multi-Partner Trust Fund, as my colleagues mentioned earlier. And also, we coordinated these tools together with the FAO Development Law Service in collaboration with One Health disease control team here, and implemented in close collaboration with our colleague from UNAP, WHO, and VOA. Addressing the AMR in an agri-food system is a key priorities for us, and guided by the FAO action plan on AMR, FAO promotes the transformation to resilient, sustainable, inclusive, and efficient agri-food system. And we support our members in reducing their reliance on antimicrobials in agricultural productions, effectively tackling the root cause of the AMR risk in the food and agriculture sectors. And that's why, as I mentioned earlier, the legislation is a powerful tool to curb AMR. It has the unique capacities to translate the policy's objective into concrete action, obligations, responsibility. That those of all action and responsibility will be taken by the government, industries, producers, and private sectors. And that's why the tool that developed by the quadripartite collaboration of the four organizations is very important. And by contributing to the health and also resilience of humans and animals, legislation directly contribute to the reducing the need for antimicrobials. And also based on the FAO strategic framework, we also discussed about how we're going to produce food with better production, better nutrition, better environment, and a better life for all. And that's why it's a key activities for us to make sure that we can improve a better life, better health, and well-being of people. It can also be pivotal in facilitating antimicrobial stewardship, ensuring prudent and equitable access and use, and preventing food contamination and the environment with antimicrobial residues. And I would like to take these opportunities to highlight that the legislation can facilitate the coordinated implementation of the National Action Plan on AMR, offering clarities on responsibility and accountabilities for proper executions. For nearly decades, all the organizations, as I mentioned earlier, has dedicated themselves to supporting the members in strengthening national legislations to address antimicrobial resistance in all areas. And most recently, FAO has engaged with the quadripartite partners to alleviate the support to embody a truly One Health perspective. And also, as many of you know, that last 2 weeks, we just have the first assembly of the AMR multi-stakeholder partnerships at FAO, together with UNAP, VOA, and also WHO. And we are expecting that these two will help the countries identify the legal areas and elements relevant to fighting AMR and aiding in prioritizing necessary legal reform and achieving policies priorities at the country level. And we need to join our effort. We need to work hand in hand to make sure that we can fight AMR together. Thank you very much.
Thank you very much, Tanawat, for these excellent points. Appreciate your highlighting the transversal nature of AMR and the value of an integrated One Health approach to tackling this important global issue, and for highlighting how important legislation is to facilitate the sustainable implementation of the national action plans for AMR. This is indeed one of our findings from the implementation of the tool in various countries, as my colleagues will soon describe. So thank you again for your kind remarks. Now we will move to the point that brings us here together today, and that is the launch and presentation of the quadripartite One Health legislative assessment tool for antimicrobial resistance. And this important presentation will be made by the international legal consultants, Valeria Passerin from FAO and Kelsey Galantich from WOA, who will share the presentation and give us an overview of the process of development and the content of the tool. Valeria and Kelsey, the floor is yours, and you have 20 minutes for this presentation.
Thank you very much, David. Can you please confirm that you can see my screen and it is in presentation mode?
Yes, we can.
Thank you. Welcome, everyone. It is truly an honor to have the opportunity to introduce you to the quadripartite One Health legislative assessment tool for antimicrobial resistance. Well, many of the people joining us here today are probably vets, doctors, microbiologists, engineers. What I want to say is that many of you are probably professionals from a technical background and not necessarily lawyers. So when you think about antimicrobial resistance, you probably think about the animals, the farms, the residues, and most importantly, about the interconnections that take place across the different sectors. This is how pathogens move from one sector to another. In fact, the red spots in this image that we are sharing are meant to be those pathogens moving from sectors. However, for us lawyers, the first thing that comes to our minds when we hear about antimicrobial resistance are the laws and regulations governing each of the sectors that are relevant for antimicrobial resistance. So we think about the medicines legislation, the human health law, the animal health law, and so on. And in particular, about those key regulatory mechanisms in each of the sectoral pieces of legislation that are relevant for controlling AMR's emergence and spread. And this is because, as my colleagues are going to explain later, most regulatory measures to address AMR can be included through sectoral legislation. And I said most, there are some exceptions. So because of these interconnections that I mentioned and the awareness of their existence within the international community, the quadripartite signed a memorandum of understanding for a new area of One Health collaboration in March 2022. This new quadripartite memorandum of understanding provides a legal and formal framework for the four organizations' long-standing collaboration to further their shared goals and objectives in regard to the development and implementation of multi-sectoral approaches to complex health challenges at the animal-human ecosystem interface, with particular emphasis on AMR. So the tool that we are presenting here today is also an effort of the quadripartite, and its development and piloting funded by the AMR Multi-Partner Trust Fund under one of its global project, the Legal Project. So this tool is also a result of the understanding that legislation is an essential element of a broader strategy to tackle AMR efficiently. However, this tool does not appear out of nowhere. quite the opposite. This quadripartite tool builds on previous experience of working on AMR. In fact, this tool is an evolution of a methodology developed by FAO in 2015 to analyze AMR-relevant legislation in the food and agriculture sectors. This earlier tool has been applied to date in 34 countries from across the globe and has also been disseminated in 5 regional workshops where over 45 countries participated. This methodology, as I mentioned, was developed by FAO, but was also reviewed by WOA, and both organizations conducted a joint mission to the Philippines for the implementation of the methodology. So we can say that these were the beginnings of a collaboration that would eventually lead to the development of this quadripartite tool that we are presenting today. But the truth is that this FAO methodology only looks at the areas that are relevant for food and agriculture. And one of the lessons learned from applying the tool was that countries were demanding a One Health approach. We all know that AMR is not a problem limited to the areas of food and agriculture, but it is a true One Health issue. So countries need to incorporate that approach into national strategies to address AMR, and for that reason, they were demanding a tool that also included the One Health approach. So to create the tool that incorporates this One Health approach, FAO reached out to WOA, WHO, and UNEP to broaden the scope of this FAO methodology and develop the One Health tool. So we can say that this FAO methodology that we are showing in this slide is at the very basis of the development of the MPTF legal project that would allow for the creation of the quadripartite tool. In the context of these same efforts, and to assist countries in addressing AMR through legislation, FAO created AMR-LEX, which is a subset of FAO-LEX. Many of you are probably familiar with FAO-LEX, but for those of you who are not, FAO-LEX is the world's largest online database of laws, regulations, and policies on food, agriculture, and natural resource management. It has different subsets, which are thematic collections that provide more focused and user-friendly access to specific subject matters. And one of them is precisely AMR-LEX. In AMR-LEX, you can find legislation and policies relevant to AMR and also AMU, antimicrobial use, within the context of agri-food systems. Also, part of the background efforts that finally led to this quadripartite tool is the document on international instruments on the use of antimicrobials across human, animal, and plant sectors. This report, whose cover page you can see on screen, was prepared in the times of the tripartite in 2020. And it describes the state of art of international standards relevant to antimicrobial use. So this publication was a necessary precondition for the tool that we are presenting today. In fact, this document collects the existing guidance across the different sectors, and this guidance is what we have included as the baseline for the development of the quadripartite tool. We can say that this document is the scientific basis for our tool, and that's why it is so important. The quadripartite tool does not create any new guidance. And this is very important. On the contrary, it reflects the already existing guidance at the international level, and it is meant to support countries in assessing their legal frameworks against those international standards. So as you can see, this quadripartite tool is the result of a long-term effort on AMR, and both theoretical knowledge and practical experience in the implementation of international standards on AMU and AMR across the different sectors. And now I would like to pass the floor to my colleague Kelsey from WOHA, who will continue with the rest of the presentation. Kelsey, the floor is yours.
Thank you, Valeria. So the tool has a couple objectives. The first is to assess national legislation relevant for AMR and to identify gaps and opportunities for reform. It's also designed to facilitate an understanding of the sector-specific needs of each legal area relevant for AMR and to contribute to AMR governance arrangements underpinned by a One Health or intersectoral approach. And as Valeria just highlighted, it's not a guidance document, but it is based on international guidance and information contained in the International Instruments Report. It explains and analyzes the relevant international standards within each chapter, which has increased its length, but the result is that any person reading this document shouldn't need to look anywhere else for sector-specific and intersectoral issues around AMR legislation. So the tool was developed in a series of steps. The first was to convene a quadripartite working group of lawyers and technical experts. And there were 7 expert meetings, one for each sector, which resulted in the development of the pilot version of the tool. And the tool was then piloted in 3 countries under the Global MPTF Legal Project. The first was Cambodia, it was Cambodia, Morocco, and Zimbabwe. And then it was implemented under Peru's National MPTF project with the help of the AMR MPTF legal team. This generated 3 reports and 3 national workshops, all of which gave us valuable feedback to help refine and improve the usability of the tool. We also conducted outreach through 2 multi-country workshops, one in Latin America and the Caribbean region, and the other in Africa. And now that led to its validation and launch, which is happening now. And it's important to note it's not online yet, but it will be published online soon in English and then in French and Spanish. So what rules do we take into consideration and what do we mean by legislation? So because AMR is such a complicated topic and the tool takes into considerations the legislation at different levels, which includes primary legislation and secondary legislation, or acts of parliament and ministerial or administrative orders or decrees. It also takes into consideration legislation at the national, regional, or self-regulatory levels. All of this is included within the use of the term legislation. And as you can see, legislation is used in a very broad sense within the document. And as you all know, this is because AMR is a very technical topic. And at the sectoral level, many rules are in lower level legal instruments, which are usually based on science. And further, the more that we take into consideration, the more comprehensive the review. So the tool is really designed to be as comprehensive as possible. So each chapter of the tool corresponds to a different sector. The first is institutional frameworks, then human health, food safety, veterinary legislation, pesticides, plant health, and the environment. And all of the chapters follow the same common basic structure. So first, the chapter gives an overview or background of the international guidance and instruments, then that are relevant for that specific sector. Then it describes where the sector might be regulated. So this section is designed to guide the consultant or person using the document on where to look for the relevant legislation, because as you saw on the other slide, there are many different places it could be regulated. And it's also designed to help them figure out where to look in the national legislation for the legislation that will respond to the questions, taking into consideration that it could be really at all different levels and in many different forms. And then it also goes over key elements and concepts of the sector legislation to consider. And finally, it includes a series of questions that are designed to analyze the legislation. And this is really the main tool. So here are a series or example questions from each of the different chapters. And I won't read through all of them, but as you can see, they are really specific to the different chapters or the different sectors. So for example, human health, does the legislation provide for licensing of pharmacies? Institutional frameworks, is there a legal basis for data sharing? So you can see really they ask for specific details to really help guide the analysis of the legislation. So on behalf of the legal team, thank you. And these are the main contact points per organization. And we look forward to hearing back from you, and feel free to reach out to any of us with questions. Thank you.
Okay, thank you so much, Valeria and Kelsey, for the clear and informative presentation about the structure and application of the tool. And now we can move to the next phase. Now that we have a good understanding of how the tool was developed, how it's structured, and how it's intended to be used, but there's more. We want to share with you our experience in implementing the tool and how we envision its deployment could happen in the future for countries that are interested in getting quadripartite support for the implementation of the tool. And to this end, I hand it over to our colleague, Carmen Bouillon from FAO. Carmen, whenever you are ready, you have 10 minutes for this presentation.
Thank you very much, David. Can you please confirm that you can see my presentation and that it is in presentation mode?
Yes, both are true.
Perfect. So, colleagues, it's really an honor for me to present this next stage and explaining a little bit what we have done so far with this quadripartite tool and how we envision its deployment could happen in the next future. So let me start by saying that as part of our project, we included 3 pilot projects in 3 countries, in Morocco, Zimbabwe, and Cambodia. These 3 countries have gone through a process of applying the tool. In this process, we have been refining and also getting feedback from colleagues in the 3 countries on the content, the extension, and the difficulties for the implementation of the tool. And we had a plus and a 4th country, which requested also the implementation of the tool through a separate national MPTF project, which is Peru. The methodology that we have followed in these countries includes first, transversal mapping of AMR legislation across sectors, across the different sectors that Kelsey mentioned in her presentation. So this has been a quite thorough exercise of going through these different areas, trying to identify which were the key legal instruments and how these responded to the key regulatory elements that we had identified and that are part of the tool. And allow me to say that this is a very useful exercise to get a broad understanding of how different sectors and different laws can influence AMR broadly. This exercise leads to the identification of potential gaps and potential opportunities for legal reform, both cross-sector and sector-specific, meaning both for each sector individually, but also for what each sector can do also to ensure synergies and coordination with other sectors. And the final stage is a discussion with the country of these gaps and opportunities for them to better define what they want to do next. It is also very important that throughout this process, there is huge participation of different stakeholders, including not only national governmental agencies, but also private stakeholders, and that national lawyers are involved in the collection and analysis of national legislation and the identification of potential opportunities for legal reform. And that makes it quite interesting capacity development process as well. At the national level, the methodology has always included first a presentation of the process to national authorities, the recruitment of a national consultant, a national lawyer, bilateral meetings with each of the institutions involved for the collection of the legislation and for the understanding of the issues that they identify in the laws, the development of a national legal report that it is then presented in a national workshop, and the validation of the report and the recommendations. In addition to the 3+1 pilot projects, we have also had a chance to share the presentation, to share the tool with different colleagues in 2 multi-country workshops, one in Latin America and in the Caribbean in 2022, and a second one in Africa and Senegal in 2023. And through these exercises, we also collected feedback from different colleagues across different regions on potential ways to improve the content and the format of the tool. So just to share with you some of the key conclusions that we gathered from the implementation of the tool. The first of them, and there was broad consensus across participants on this, is that legislation effectively serves to implement AMR policy objectives and to make them enforceable and sustainable in time, beyond the political momentum, to create a concrete framework of accountability that clarifies the roles and responsibilities of each institution. The second conclusion is that a legal architecture to address AMR requires a combination of sector-specific and cross-sectoral legal instruments. What we mean by that is that most of the key international recommendations, the international relevant standards that apply to AMR, can very well be incorporated into national legislation through sector-specific laws, which have traditionally ruled each of these sectors. In fact, our finding is that cross-sectoral legislation that addresses AMR specifically, should not enter into the sector-specific elements across the different areas, as that would lead to legal fragmentation for each of these areas. Just to put you an example, if a country would develop an AMR law that regulates bits and pieces of environmental law, of medicines laws, of food safety law, etc., at the end, it would be very difficult to identify what is the law that regulates medicines, what is the law that regulates environmental protection. And that would lead to poor clarity and to what we lawyers call legal fragmentation. However, there are some elements that could be well framed in cross-sectoral legislation. For instance, the establishment of a multi-sectoral governance mechanism for AMR, or a common legal basis for setting up a program for integrated surveillance. The last of our conclusions is that the access to quality antimicrobials, disease prevention, and also pollution prevention and control are key pillars of AMR regulation. And now what comes next? I'm going to explain you a little bit what you're going to find in our quadripartite website very soon. We have not yet been able to put this online, but this is only due to some bureaucracy across the organizations. But very soon, the quadripartite website will host the quadripartite One Health legislative assessment tool. And you will find 2 versions in the website, a short version and an extended version. The short version is the actual tool. It is divided in the sections and chapters that my colleagues have explained. And it is aimed for countries that want to apply the tool under a One Health approach, that want to apply the tool taking into consideration all its different chapters. But you will also find an extended version. This extended version is much longer. It is divided into much thorough separated chapters, and it is aimed to provide countries a more detailed tool and mechanism in case they want to enter more in detail in one of the sectors. We have realized this is very thorough and it would be difficult to apply in its entirety. So this is why the short version is also included in the website, and it's the One Health tool version that we would recommend countries to apply first. But if a country has already applied the short version and wants to dig a bit more into one of the specific sectors, the standard version would give this type of guidance. In both versions, you have a synthesis of the international guidance that we have been able to collect to date on the basis of the international instruments document that Valeria presented in the last presentation. And you will also find in both versions a cross-cutting chapter on institutional frameworks and cross-cutting legal responses that addresses issues related to the governance of AMR from a regulatory standpoint. Our intention is that this tool will help countries mapping out AMR-relevant legislation across sectors. It will help improve multi-sectoral coordination. It will facilitate the implementation and enforcement of the national action plans. And it will introduce a One Health approach to sector-specific legislation by helping every sector individually to identify what are the implications of the sector for other sectors. So this is all from my part. We'll remind you that the Q&A is always open, and we will try to respond to all your questions. Thank you very much. And over to you, David.
Thank you so much, Carmen, for this overview of how the piloting of the tool was conducted in 4 countries, and also how explaining to us how countries can use and benefit from this tool moving forward. Okay, and like Carmen, I'd like to remind you again to put your questions in the question and answer box. We're doing well on time, so we will have ample time during the designated question and answer session to answer questions. So please don't be inhibited and feel free to include questions in the Q&A box. We'll be able to get to quite a few of those questions, I think, during the question and answer session. Okay, so with that said, I would now move to the next session, experiences in the implementation of the tool at the national level. And it's my pleasure to introduce Dr. Tinashe Hodobo. And Tinashe works for the Ministry of Agriculture in Zimbabwe, and in that capacity is part of the One Health Secretariat in his country. And Tinashe's continuous support during the tool piloting in Zimbabwe was really essential to the successful completion of the process. And we're really pleased that he was able to join us today and describe to you the implementation of the tool from the perspective of his experience in Zimbabwe. So Tinashe, thank you again, and the floor is yours. You have 10 minutes for this presentation.
Thank you, David. So I'll just maybe start with sharing briefly what the One Health Secretariat, a brief history of how that was set up, the origin and the role in the fight of antimicrobial resistance. So we launched our first National Action Plan in September 2017, and with it there was a coordination mechanism that was part of that, the implementation strategy for the National Action Plan. And the leadership for the Secretariat then, which was the organ for the coordination of activity, was mainly with the civic society organizations. But later on, with time, that was reviewed, And the current structure of the One Health Secretariat is anchored within the line ministries of Human Health, Agriculture, and Environment. And the individuals that have been committed to focus on implementation of AMR activities according to the National Action Plan. So that is the current arrangement that we have. And we do have focal points for One Health as chief directors from the ministries that I've mentioned. So it's just to give a brief background in terms of how the AMR activities are being coordinated currently within the country. Next slide. Then maybe to come to how we got to join the MPTF, the piloting of the two as a country. This goes back, we can go back to May 4th in 2022. That was last year. So we had an introductory meeting where then it was the tripartite, but later on it became with the involvement of UNEP. It was more of a quadripartite effort. And then from there was a presentation of the two to us as the Secretariat and other members within the government and our country, so that we could familiarize with the two and the possible benefits. And the next step for the country was to confirm participation in the pilot, of which that confirmation came with consultations with the focal points for One Health, the chief directors, which I mentioned. The confirmation that we really wanted to be part of it, there was favorable response from all the ministries, because we recognize the benefits of the two in terms of areas where we also knew that we needed some strengthening, AMR governance, and also in terms of the regulation itself across the different sectors. Next slide. So the way that the two was implemented within the country, in February 2023, with the launch of the pilot project within the country. And then soon after, in March, that was followed by, interaction with the legal consultants. The legal consultant communicated with the Secretariat, and we went through identification of key offices within the ministry, the Ministry of Agriculture, Human Health and Environment, focal people that were important for the providing information concerning the status of our legislation, specific chapters of legislation, which was really important for the AMR topic, and also to assign responsibilities to specific people that were going to engage with the consultants. And from that point onwards, engagement continued, and there was also continuous engagement with the Secretariat using multiple channels of communication. So in June 2023, like I mentioned in the previous slide, I think there was further strengthening of the involvement of UNEP from the context of the activities within our country, because initially it was the World Organization for Animal Health, FAO and WHO, but UNEP also came on board, and they were also contributing to the processes that were happening. Next slide. After the consultative process was concluded, the findings by the consultant were now presented, and we had a virtual meeting where the findings were presented on the 20th of September. And then we had to gather around a lot of stakeholders across the sectors to be part of, receiving this information from the consultant. On the 2nd of November, that's when we managed to have a lot of stakeholders coming in and also receiving some feedback. And what we came to as a country in general, we saw that this process was very valuable based on many recommendations that I won't go through during this presentation. that it's an opportunity for the country to strengthen the AMR governance, because, you know, there are a lot of legal steps that are still pending in terms of strengthening and solidifying our coordination mechanism for antimicrobial resistance, which goes into sustaining actions to have sustainability. And then we stand a chance of maybe turning the tide against this battle against antimicrobial resistance, should we have a sustainable structure anchored within our legal system. And also the collaboration itself can also be strengthened because of the implementation of the recommendations that are within that. I also need to mention that the process of consultation and validation also involved some legal experts within our ministries, some lawyers. So they are also on board in terms of the next steps. They have a full understanding of the subject matter, what needs to be done, and the recommendations that have been put on the table. I think for now, that will be adequate as feedback in terms of, in summary, the process from when we started with the pilot and up to the time that with that final presentation with the stakeholders on board. Thank you so much for listening. Over.
Thank you very much, Tinashe, for a very interesting presentation. Appreciate it, much appreciated. Okay, so now we have the opportunity to move to our question and answer session, which will be moderated by Jorge Mateo from our colleague on the team from WHO. And we want to thank all the panelists for having stuck to their time. In fact, done a heroic job because we're ahead of time. So now we have an ample amount of time for questions. And with that said, I will turn it over to Jorge, who will facilitate this part of the presentation. And Jorge, the floor is yours. Thank you.
Thank you very much, David, and good day, everyone. We now open our space for questions and comments. Before we begin, we would like to note that we will do our best to respond to all the questions. But if this is not possible due to time constraints, we will encourage you to write us by email, and we will send you a response. Let's move on then to the questions. We have some very good questions. So I will start with the question sent by Chick. Carmen, can you answer this question, please? The question is, Fall is wondering if the legislation validated by the quadripartite is linking to national legislation policies for better implementation.
Mm-hmm. Thank you very much for the question. This is indeed an excellent one. So the tool is a collection of international relevant standards. And what we have done is to identify what a country would need to incorporate into national legislation for the implementation of those international standards. So the focus of the tool is really the national legislation. And the application of the tool, the use of the tool, would lead to the analysis and potential revision of national legislation. So it's not that we have validated or endorsed the international guidance. International guidance is there, is approved by intergovernmental bodies or international institutions. It's approved by the Codex Alimentarius Commissions, by OHLAT standards, by international guidance provided by quadripartite organizations. And the application, as I said before, is actually focusing only on the national legislation. So yes, indeed, the application of the tool would serve for strengthening national legislation and also aligning national policies with international relevant guidance and standards. Over to you, Jorge.
Thank you very much, Carmen. The next question is, maybe you can also help us with this, Carmen. The question is from Amos Lucky, and the question is, does this tool have a scale to determine the level of competence of each of the the sectors?
No, not at all. It's not progressive management tool whereby we assess whether a country is at a certain level of development of their legislation. Is more than that, it just helps throughout the whole range of different laws and legal elements across different sectors. It helps identifying opportunities for improvement. Some of these international guidance is very new, so it would be rare that countries have incorporated the whole range of questions that are there. But the purpose is not to providing an assessment of whether a country is at level A or B, but more broadly and more simple, just to identify these opportunities for legal strengthening.
Thank you, Carmen. Let's go with the next question. Maybe Kelsey or Valeria can help us with this one. I think that this has been already explained during the presentation, but maybe you can elaborate more. The question is, does this tool can be used to harmonize the AMR legislation across different organizations at country and regional level? Over to you, Kelsey or Valeria.
Thank you, Jorge. As Carmen said, the idea of the tool is really to help countries to undertake a national assessment of the legislation. We are not creating any new guidance. So the idea is that countries can assess their national legislation against those international standards. I don't know if maybe Kelsey can comment on this.
Yeah, I mean, I think in going through that process, if everybody, uses the same tool and it's based on the same guidance, I think it will naturally become a bit more harmonized. But yeah, the tool itself isn't designed to do that.
Thank you very much. Let's move to the next question. Carmen, can you help me with this? The question is from Laila Lochte. There is also a need for international legislation. Are you also working on this?
The focus of the tool is the national legislation, and this is based on international reference standards and guidance. It is not the purpose of the tool, or it has not been the purpose of the team working for the tool to work more broadly on international legal instruments addressing AMR, not at this stage.
Thank you, Carmen. The next question I put together because I think that is both of them are related. So maybe you can help me, Carmen, Kelsey, or Valeria. And the question is from Michelle Christie Tiwola and also from Alpha Madu Diallo. How can the countries be supported to implement this tool? And what guided the choice of the pilot countries? What are the steps to invite the team to deploy? Sorry, what are the steps to invite the team to deploy the tool in a country? Mm-hmm. So first, how countries can be supported, then how the countries that has piloted this tool were selected, what were the requirements and what are the steps to invite the team to deploy the tool in the country? Over to you. Thank you.
Colleagues, maybe I can start and then you follow. Excellent. So we are part of a project funded by the Multi-Partner Trust Fund, as we have said repeatedly, and this project included global components and national level components. Ours is one of the global components. We have worked at the global level, and we have worked very closely with the countries that were part of the national components. So Zimbabwe, Cambodia, and Morocco were countries that were implementing national projects within this multi-country trust fund, and they asked specifically to be part of this pilot. And we were very grateful for this, we received a request from the teams at the national level, from the national counterparts to do so. This is why we have picked up these countries, because there was a specific request. But we were very happy of having countries that are also very diverse in the legal systems and the manner in which they have structured the AMR-related legislation. So for the application of the tool, for the pilot application of the tool, they were perfect because they are coming from different legal systems, and that allowed us to see whether the tool was working well for all these different legal systems. And actually, we made a lot of changes to the tool on the basis of the feedback we collected, thanks to the collaboration, the excellent collaboration of the different teams at the country level. And countries are always welcome to send requests to the quadripartite. You know that the quadripartite, as Valeria mentioned, is structured now. We have a memorandum of understanding. We have a number of activities together. We have funds for deploying activities. Of course, these are limited, but it is our philosophy that we act upon request. So countries are welcome to request this support. We encourage countries to apply the tool and to request the support at the quadripartite level, as we really believe that the tool makes sense under our One Health approach. And what we have seen in the past is that the application to specific sectors left things out. And for countries to have a comprehensive vision of the AMR legislation, this One Health implementation was so important. And this is why we have decided to work quadripartite, and this is a product of the quadripartite. But if a country decides to go for a specific sector with a specific organization, they can also do it. And this is why we are putting also online the extended version to facilitate this. And colleagues, if you want to add something.
Yes, Carmen, maybe also to mention that the tool is going to be publicly available, so a country might very well decide to go ahead with its implementation. But if they request the quadripartite assistance, as you said, there are other benefits involved. And an additional one I would like to mention is that we will also help create capacities, to develop capacities at the national level. We have seen this in the piloting of the tool, and how as international experts on the existing standards, we were able also to provide specific guidance to the national legal consultant recruited. So it is also supported the development of capacities at the national level.
And yeah, I'll just add, as Carmen was saying, though, it's encouraged to apply it at in the comprehensive One Health approach. So it's encouraged that all chapters will be applied together. Countries are invited to, if they would like help with a specific sector, they can ask that for that assistance from one of the specific quadripartite organizations. So for animal health, for example, you could send a request to WOA for help with that specific sector, or for human health, WHO, for example. So that is also an option. It is designed to be possibly used in that way. But again, that's not encouraged necessarily.
Thank you.
I don't know,
Thank you
David.
very much. Yes.
Oh, that's
Any
it.
other comment? Okay. Thank you, Kelsey, Valeria, and Carmen. Another question is, could the tool be used for larger structures such as Europe? For broader legislation within group of countries, it is also possible at the international level. I think that the question is related if this can be also applied as a group of countries at regional level. This is also one of the things. So Carmen, can you help with this question?
Yes, indeed. Yeah, the tool goes through the legislation across different sectors. For regional organizations that have the capacity of enacting legislation that's applicable across the different countries, they can always decide to use this to check whether the regional level legislation meets the different regulatory elements that have been identified as critical in the tool. True, a regional organization may not have decided to put one of these sectors at the regional level. So a regional organization may have decided that they do not want to have regional level legislation across all the topics that we address in the tool. And that does not mean that there is a gap at all. It just means that that group of countries have not decided to regulate that at the regional level and that they're regulating it at the national level. But for a regional organization that has decided to embark into the regulation of a specific topic or sector at the regional level, and that has enacted legislation in that sense, the tool can indeed serve to monitor whether the elements that are included in the tool have been incorporated in the manner that are explained in the tool.
Thank you, Carmen. And thank you all for your question. I think that we have a very good question, but also we have time. So let's move to the next question. And this is, I think that it's important because it's bringing what is the difference between this, the objectives between the One Health legislative assessment tool and the National Action Plan assessment tools. So, Carmen, can you help us, Valeria or Kelsey?
It's an excellent question. It's really a very good one. Thank you so much for that. So the difference is that this tool focuses on legislation. What it is, I mean, the objective of the tool is to identify what's written in the national laws. NAPs are much broader. NAPs are documents that are aimed at identifying the objectives of a country in terms of the policies and strategies in relation to antimicrobial resistance for the coming years, for a number of years to come. And they touch upon many aspects, not only what needs to be incorporated into national legislation. So the case might be that a NAP, and in fact, our research shows that this is effectively the case. The case might be that a NAP highlights the need for filling a regulatory gap that has been identified by the country. And in this sense, we believe that applying the tool can help countries identify these regulatory gaps so that they can use them for updating their NAPs. But also, because the tool helps identifying the key legal elements for incorporating international guidance on AMR, we firmly believe that the application of the tool can help a lot in the implementation of the objectives included in the NAPs. So it's two different, completely different documents, but that they are interrelated and interlinked in the sense that the tool could serve for NAP implementation and also for the revision of the NAPs in the years to come.
Thank you, Carmen. I have the next one is a very good comment and also a question that is important based on this new tool. Addressing the enhancement and enforcement of legislation in low and middle income countries is a time consuming. In light of the pressing imperative to combat AMR, what recommendation do you propose to expedite this process? I mean, the implementation of this legal tool in countries.
Mm-hmm. Sorry, I had a problem with the audio when you were reading the.
Can I repeat?
Yeah, either that or. Mm-hmm.
Yes, the point is that the comment is related to the time consuming to address the enforcement of legislation in low and middle income countries. So what is the recommendations that you have to propose and to expedite this implementation of this, the application of this new tool?
Mm-hmm. Thank you very much for the question. Indeed, legislation that looks very good in paper but is not implemented is not the desired outcome of a legal reform process. And it is true that many countries face challenges for the implementation of legislation. The first recommendation could probably be that legislation needs to be tailor-made to the country situation and the capacities of the country for the enforcement of the legislation. So it's very important that legislation is drafted not only in consideration of international reference standards, but also in consideration of countries' capacities for the implementation of the law. And a participatory process, a bottom-up participatory process, whereby the impact of the legislation is measured before the legislation is enacted. So something like a regulatory impact assessment takes place, and that it is adapted to the enforcement capacities of a country, facilitates the implementation and enforcement of the legislation at a later stage. So the enforcement of the legislation starts in the same process of developing the legislation. I think I could leave it there, and maybe some other country wants to add something, some other colleague.
Dinashe, do you have any comment? It's frozen. Thank you, Carmen. Let's move to the next question. And this is regarding the update of this tool. This is new tool, but the question is also, I think that is important because we can also explain how this tool will be updated. The question exactly is, could you explain how often the tool is updated? If some international standards on AMR are amended? Is it conducted annually or immediately?
Mm-hmm. Yes, it is very important that even when the tool is based on international relevant standards, as we have said repeatedly, what it does is to identify the legal responsibilities for the implementation. So what we have seen, and this is something that we have faced throughout the deployment and the development of the tool, is that the standards indeed change, because AMR is based on science, and this science is evolving rapidly, I would say. So these standards change, but the actual legal responsibilities for the implementation of key regulatory elements are less subject to frequent change. And I'm going to put you an example. For instance, in the registration of pesticides that are antimicrobials that are used as pesticides, what we are interested on and what the tool looks at is not specifically the process of registration of a pesticide, which is something that can change very often. What we're interested in is in analyzing whether national legislation has a mechanism for identifying the criteria for the authorization of that pesticide that could take into consideration AMR. So that is less subject to change. The tool has questions on environmental impact assessment, and to which extent legislation requests an environmental impact assessment for the authorization of a specific activity which can create pollution, and this pollution resulting to antimicrobial resistance. So what we focus on in the tool is on the regulatory mechanism, the environmental impact assessment, and to which extent this mechanism could incorporate AMR criteria. So as you see, it's really the regulatory mechanism through which the international standard is incorporated into the law, rather than the specifics of the international guidance. Said that, it can always happen that there is new international guidance that would suggest, that would deserve that an update in the tool. We have not yet defined how this could take place, but we could always foresee an update when there is significant new international guidance that suggests that some of the questions or the references in the tool become outdated. And it's something that the quadripartite would do following the same procedure we have followed for the development of the tool.
Thank you, Carmen. Another question. I know this is an important question, and definitely the answer is yes, but you can elaborate to explain what is the importance. Do you think it would be useful to train national lawyers to support the deployment of this tool in the countries? Mm-hmm. Over to you, Carmen.
Maybe some of my colleagues want to answer that?
Yes.
Kelsey or Valeria?
Valeria, Kelsey?
Okay, maybe I can start. So if a country requests the quadripartite assistance for the implementation of the tool, one of the first things that we would do together with with national authorities is the recruitment of a national legal consultant. It is very important for us that the tool is applied in a country by a lawyer, by a national lawyer that is familiar with the legal system and so on. So one of the big benefits of requesting the quadripartite assistance is actually that we would be working together very closely and in continuous communication with this national legal consultant. So there we would be also training him on the application of the tool itself and within the different sectors considered in the tool. We would be overseeing all the assessment that this person would be conducting, and also providing that technical backstopping from an international perspective. So yes, it's not a separate phase, let's say, even if, of course, one of the first meetings we would have with this national lawyer is also an explanation and more technical explanation of the tool, but it is something that is done in parallel with the application of the tool. And of course, one of the outcomes of the process is not only that the country will have a national legal report where they have the main findings regarding legislation that is relevant to AMR, the identification of that legislation, and also the identification of potential legal reforms to address the gaps that were identified, but also that they will have at the national level a lawyer that is very much trained in the implementation of this tool and is aware of the key regulatory mechanisms relevant to AMR throughout the different sectors that the tool considers. So he or she would really have this One Health approach. Don't know if yeah.
Yeah, I'll just add that the tool is really designed so that a lawyer who might not have the technical background can go and look at the background section or the key elements section, and even then they can go and dive deeper into some of the international instruments so that they can really get a comprehensive overview of the specific topics in the specific sector. So the tool is really designed to help almost with some self-training in a way. And as Valeria said, then there's the quadripartite support and backing to help with any technical questions or explanations.
Thank you very much. Carmen, do you have additional comments?
No, it's fine.
Thank you very much. So I think that we have the last question. I think that the question is for the three of you. And I think that is really interesting because we'll highlight the importance of this tool. The question is legislation necessary? Could the same outcome be achieved through cooperation between agencies and industry? So I will start with you, Carmen. Over to you.
Let me start by saying that cooperation with the industry is a must. It's not something that can supersede or be used in alternative to legislation. It needs to happen anywhere. And what we have seen is that in many countries, the private sector has actually led collaboration and multi-sectoral collaboration on AMR. So private public collaboration on issues related to AMR is indeed very important in any case. Depending on the national legal system, the setting up of a multi-sectoral structure may need or not legislation to be established. That depends on the national legal system. There are national legal systems where interministerial collaboration can happen in the absence of any legal mandate included in a legal instrument. There are countries where this is not the case, and for two ministries to put some structures together, they need a legal instrument to establish this collaboration. So that depends on the national legal system. Anyway, the tool is much more than a tool on the regulation of multi-sectoral governance mechanisms for AMR. This is only one of our chapters. There are other six chapters go through the different sectors and enter into the identification of the legal elements that should be incorporated for each legal area specifically. So it's much more than that.
Thank you, Carmen. Valeria, Kelsey, do you have any comment?
Yes, Jorge.
Thank you, Valeria.
So actually, one of the things that we learned from the multi-country workshops where we participated also to present and validate the tool was that countries were actually discussing some of the challenges that they were still facing. And even if they didn't do this in legal terms, we could hear that they would, for instance, mention the need to formalize this multi-sectoral collaboration mechanism, as Carmen mentioned, or to provide sustainability, but also, well, some of the challenges that they would mention could be solved through legislation. So even if, as Carmen said, it is not always the solution, what we have learned is that legislation is a key element that is part of a broader strategy to tackle AMR. There are other elements needed, but legislation and its specific features, for instance, to translate into concrete obligations and held the different authorities responsible for them is something very unique that legislation can do. So yes, legislation is necessary as part of this broader strategy.
Mm-hmm. And a good example is data sharing. There are countries that are facing trouble to share data across different institutions because there is no legal mandate that obliges different entities to do so. So data sharing and integrated surveillance can be supported if there is a concrete mandate. This is, of course, is not the case for every country.
Thank you very much, Valeria, Kelsey, and Carmen, for this, for your answer and comments. And there are some additional questions, but I think that you will find the answers when you review the full document. But then we are open to receive your questions and also share our thoughts and comments about and solve your questions. Thank you very much to all who participated and contributed to this rich discussion. We must now close the Q&A session and move to the final items on our agenda. For that, I wish to hand over to our moderator again. David, the floor is yours.
Thank you, Jorge, for your excellent facilitation of the Q&A session. Thanks to all the participants for their interest in knowing more about the tool. And the questions were indeed very stimulating and appropriate and relevant. And it was good to hear the answers. So now, with that said, I'd like to move towards the closing sessions. And before we have the final closing remarks, I would like to have the opportunity to welcome a few remarks from Blaise Kumlangan. And Blaise is the chief of the FAO Development Law Service and has supported and been engaged in the development of this project and the tool from its very early stages. So Blaise, the floor is yours.
Thank you, David. Dear participants and colleagues, I thank you very much on behalf of the Development Law Service for the opportunity to participate in this event, and through not just through my presence, but also the presence of my colleagues in this panel. I know the agenda is tight and we're running out of time, although I think we have handled it very well. So I will attempt to be very brief. We have repeatedly heard why legislation is important to AMR, and I think the last couple of questions drove this point home. And as Carmen said earlier, it is not necessary, perhaps, to have legislation, but where you want it to follow through in terms of the requirements and elements that you want to implement and ensure that they are complied with. Legislation legislation is necessary, and without legislation, there cannot be effective compliance and enforcement should the need for that arise. It may be the less desirable outcome, but we need to get through to that end result as well. So allow me to give you three key components to facilitate the law implementation, compliance, and enforcement. Firstly, and this has been mentioned by Carmen, tailor legislation to national realities, ensure alignment not only with the international standards, but more crucially with national capacities and collective priorities. Obligations should be formulated as progressive objectives with appropriate transitional periods. So in this context, conducting an ex-ante regulatory impact assessment can help identify actual enforcement capacities. Second, foster participatory law development. A participatory law process involving experts, national lawyers, and stakeholders creates the opportunity for consensus, legitimacy, and ownership of the legal framework necessary for the effective implementation and enforcement of legislation. Third, and not least, comprehensive capacity development. This will involve engaging all implementation authorities in capacity development activities related to law development and implementation. This includes inspectors, enforcement authorities, and the judiciary, all of whom must understand the legislation thoroughly to facilitate its successful implementation. I part by saying there is no replacement for collaboration at all levels, as Carmen said, regardless of whether there's legislation or not. Collaboration at all levels, and in particular, industry, regulator collaboration, other stakeholder collaboration. All this is necessary for successful implementation of the standards and guidelines that have been set at the international level, and which are important to be implemented at the national level. So I thank you again for the opportunity, and now yield the floor back to David.
Thank you very much, Blaise, for your remarks and your keen insights on the legislative process and its value around AMR. We thank you for that. And now I would like to hand over the floor to Mamaisa Embo, who is the coordinator of the Multi-Partner Trust Fund, to provide us with the closing remarks for this session. Mamaisa, please, the floor is yours.
Thank you very much. First of all, I just want to thank everyone for this fantastic meeting. Thank you so much for your active participation. I think it has been a very beneficial meeting and the discussions have been rich. And I think that the questions are also fantastic. The MPTF has indeed been very successful in demonstrating that a quadripartite can collaborate as one to achieve concrete outcomes, as well as implement national action plans on AMR. But most importantly, it's also supported development of tools such as this particular one, the quadripartite assessment tool for legislation. It has been a long road to get here, but finally we have done it and the results are extremely impressive. Excuse me. I would like to thank you all for your time and for your participation. I encourage you to use this tool, implement it in your countries. Let's make it operational. Lastly, I want to thank the organizers and as well as the technical team for your hard work in developing this extremely impressive tool. I thank you once more again, and I wish you all a wonderful day.
Thank you, Mamaisa, for your generous comments and your support of the team and the efforts that were involved. And with that, we have reached the end of our event. And thank you all for your attendance. We had as many as 249, I think, at one point during the hour. And remember that we have a second session again this afternoon. The same information will be covered, but it's for the other half of the world in the different time zones, and will be with interpretation in English and Spanish starting this afternoon at 1600 Central European time. So with that, I thank you all again and wish you a very pleasant afternoon, evening, or night. So goodbye all.